Now to continue our lecture about viral hepatitis. Hepatitis D or Delta virus can cause acute hepatitis on the top of B hepatitis. So it requires hepatitis B virus for replication and has the same source and mode of spread. نحكي على mode of spread والsource مال hepatitis D هو نفس hepatitis B. Diagnosis depends on detecting HDV antibody. Management is effective management of hepatitis B. So effective management of hepatitis B, it will effectively manage and prevent hepatitis D. Now hepatitis C, it's very important. Hepatitis C, we call it post-transfusion hepatitis. Acute symptomatic infection with hepatitis C is rare. يعني نادرا ما نشوف acute hepatitis type C. ممكن type B, A, E, D. لكن type C is very unlikely. أكثر شيء نشوف chronic hepatitis with type C virus and are only identified when they develop chronic liver disease. 80% of individuals exposed to the virus become chronically infected, and late spontaneous viral clearance is rare. إذا عكس hepatitis B من يدخل hepatitis B 90 to 95% will be eradicated, will be cleared. هنا بالعكس من يدخل hepatitis C 80% will persist, 20% will clear. So hepatitis C used to be known as non-A, non-B hepatitis previously. It is a blood and blood products as the main source of infection. Investigation of patients with hepatitis C who by doing the hepatitis C antibodies, HCV antibody, but it may persist in serum even after viral clearance, whether spontaneous or post treatment. فلذلك بنساعدنا hepatitis C viral infection مثلا positive والpatient treated or eradicated بعد ما نعتمد على HCV antibody لأن يبقى positive even after spontaneous or post treatment clearance. There are 6 common viral genotypes whose distribution varies worldwide. We have genotype 1 to 6. We have 6 genotype. وال1 يقسموه إلى A and B. Genotype has no effect on progression of liver disease but does affect response to treatment. فأهم شيء حقيقة بالنسبة للريسبونس اوف تريتمنت بنعطي انتي فايرال للتايب سي هيباتيتس يعتمد على الجينوتايب. واكو جينوتايب يصير عندهم جود ريسبونس واكو جينوتايب يصير بور ريسبونس. مثلا جينوتايب 1 is most common in North Europe and is less easy to eradicate يعني poor response to treatment with the current treatment. The predominant of HCV genotype in Iraq مثلا عندنا احنا 1B وعندنا genotype 4 بس الكمن هو genotype 4 طبعا followed by genotype 1B. How do you manage and treat patient with HCV positive hepatitis C positive? The aim of treatment is to eradicate infection. ليش؟ لأنه راح يسوي لنا chronic liver disease وممكن liver cirrhosis with hepatocellular carcinoma. Treatment of choice is previously we use pegylated alpha interferon given weekly subcutaneously together with oral ribavirin. Ribavirin is important antiviral agent for treatment of hepatitis C. Virological response أيضا نقسمها إلى early virological response و sustained virological response EVR و SVR. Virological relapse can occur in the first 3 months after stopping treatment and the cure is defined as loss of virus. شلون نقول هذا cure? Loss of virus from serum 6 months after completing therapy. Sustained virological response أو SVR. إذا صار عندنا loss of the virus from serum 6 months after completing therapy. The length of treatment and efficacy depends on the viral genotype. 12 months treatment مثلا for genotype 1 results in 40% SVR بينما 6 month treatment of genotype 2 or 3 with SVR reaching up to 70%. Response to treatment is better in patients who have an early virological response. فإحنا المرضى اللي يصير عندهم early virological response هم أكثرهم راح يصير عندهم بعدين sustained virological response. فإذا صار early معناتها هذا راح يطيب. إذا ما صار early response delayed response هذول عادة يبقون delayed, they will not respond to treatment. فإذا who have early virological response they have a good response as defined by a negative HCVR. يعني ال early virological response شنو هو negative HCV RNA in serum 1 month after starting therapy. 1 month هذا early virological response, and it may be possible to shorten the duration of therapy in this patient group. يعني مثلا مقررين نطيش سنة من صار عنده HCV RNA صار عنده early virological response احتمال السنة تصير 6 شهور. You may shorten the duration of treatment. طبعا هنا نجي نقول 12 weeks treatment with oral sofosbuvir. هسه was Sovaldi available, very famous antiviral agent for the treatment of type C hepatitis. Plus you can give it alone or plus lidipavir أو ribavirin. هسه الموجود ribavirin sofosbuvir, two antiviral agent can achieve 99% SVR in treatment genotype 1 patients. Sofosbuvir plus vilapasvir أيضا achieve similar efficacy and similar treatment. Other يعني options of treatment patients with chronic liver disease type C هو liver transplantation should be considered when complication of cirrhosis occur. يعني صار عندنا portal hypertension, صار عندنا variceal bleeding مثلا، هنا نفكر بالliver transplantation. لكن keeping in mind that hepatitis C is almost always recurs in transplanted liver, and up to 50% of patients will develop cirrhosis in the liver graft within 5 years of transplantation. إذا يصير عندهم recurrence ويصير عندهم أيضا liver cirrhosis. There is no active or passive protection. حتى نحط البي ويا سي ونقارن إنه type C hepatitis نخاف من عنده ليش؟ لأن there is no active immunization. There is no passive immunization. يعني ما عندنا لا immunoglobulin ولا عندنا vaccination against hepatitis C virus. Progression from chronic hepatitis to cirrhosis occur over 20 to 40 years. Risk factors for progression. وين يصير هذا progression؟ كل إنسان لا، هذول الهيفي الكوليك مثلا، الميل جندر، البيشنتس اللي immunocompromised، البيشنتس اللي HIV positive مثلا، هذول incidence of progression to chronic liver disease and liver and chronic hepatitis are more than the other individuals. Not everyone with hepatitis C infection will necessarily develop cirrhosis, but approximately 20% do so within 20 years. 20% within 20 years. Once cirrhosis has developed, once complications like ascites have arisen, the 5-year survival is around 50%. Once cirrhosis is present, 2 to 5 per year will develop primary hepatocellular carcinoma. Now, hepatitis E virus. Hepatitis E virus يشبه hepatitis A virus. أيضا regarding presentation and mode of transmission. Clinical presentation and management of hepatitis E is similar to that of hepatitis A. Disease is spread via the fecal-oral route. In most cases, it presents as a self-limiting acute hepatitis and does not cause chronic liver disease. فما عندنا هنا لا chronic liver disease ولا carrier state. Hepatitis E differs from hepatitis A in that هاي النقطة المهمة إنه it affect pregnancy ويصير عندنا بالpregnancy اكو risk مال acute liver failure which has a high mortality. فإذا لقينا patient pregnant وعنده acute liver failure وفكرنا بالهيباتيتس viral hepatitis فأكثرهم ذولا hepatitis type E. Antibodies to HEV are positive. إذا نريد نسوي testing ونريد نعرف هذا E موجود لو لا فندز HEV virus antibody. Other forms of viral hepatitis غير ال E وال A وال C وال D وال B هو ال non-A, non-B, non-C أو non-A to E hepatitis is thought to be due to viruses that is not HIV, not HPV, not HCV and not HEV. This is the hepatitis E virus, simulate hepatitis A virus. Other viruses which affect the liver probably do exist, but the hepatitis viruses described above now account for the majority of hepatitis. إذا majority of hepatitis viral hepatitis هي اللي حكينا عليها. لكن يبقى CMV يعني cytomegalovirus, Epstein-Barr virus, EB virus, yellow fever virus, herpes simplex virus, and other viruses can induce viral hepatitis, especially in immune compromised patients. Abnormal liver function tests are also common in chickenpox, HIV, and rubella. طبعا إذا سوف ريفيو على الفيرال هيباتيتس والفيروسز A, B, C, D and E. الفيروس كلها RNA ما عدا ال B هو DNA virus. This is very important. Second هو السبريد فيكو اورال ال A وال E قلنا فيكو اورال بس يبقى البلاد والبلاد برودكتس هو لل B وال C وال D. Sexual transmission common in B and D. Uncommon sex transmission and vertical transmission from the mother to the baby in type C. Uncommon to have sexual and vertical transmission. Chronic infection B, C, D are common. Prevention, there is active and passive immunization in type A. There is active and passive immunization, hyperimmune in type B. There is no active and no passive immunization in type C. Type D هو ال prevention of hepatitis B vaccination. وبالنسبة لل E there is no either vaccination and there is no immune serum globulin. يعني there is no active and there is no passive immunization. Because of hepatitis is very important issue and a common disease and leading to a sequelae and many complications. So اليوم العالمي للالتهاب الكبد الفيروسي which is 28th of July every year aims to raise the global awareness of hepatitis and encourage prevention, diagnosis and treatment. Approximately 500 million people worldwide are living with either B أو C 350 مليون, B 170 مليون, C around the world. If left untreated, hepatitis B and C can lead to advanced cirrhosis, hepatocellular carcinoma and liver failure. Every year 1.5 million people worldwide die from either hepatitis B or C faster than they would from HIV and AIDS. Hepatitis B infections result in 500,000 to 1,200,000 deaths, and hepatitis C results in 300,000 deaths per year worldwide due to complications. And thank you.